In today's video, we'll be talking about LPNs, LVNs. We'll talk about the difference in just a minute, aka there really isn't one. And should you become one? And while I can't answer that for you, I can give you some things to think about while you are mulling it over in your mind for yourself. If you're new here, welcome. I'm Liz. I'm a family nurse practitioner. And before that, I was a bedside nurse for many years in adults and pediatrics. And I have never, full disclosure, I've never been an LPN or an LVN. I've worked with some phenomenal nurses who are LPNs and LVNs. And I've talked to many people through this platform who hold that title. So that is where I've gotten most of this information, as well as just like some hard cold facts from, the internet. And my hope through this video is just to give you a perspective of, like things to think about if you're making this decision. If you are an LPN or an LVN, I love for you to go down in the comments and just answer questions, talk with people. Since I have never done this, like I said, this is all things that I've just researched and talked with many people about, but your insight is obviously the best because you've done this. All right, so I get asked all the time, should I become an LPN? Should I become an LVN? Should I do this before going to nursing school? Like, what does this look like if this is my end goal? So I thought we would kind of break some of those down today and just talk about it. And in order to do that, we have to kind of lay a foundation of what is this role and maybe how does it differ from a registered nurse role, and dive into all that just briefly. So first, an LPN and an LVN, a licensed practical nurse and a licensed vocational nurse, are, as far as I can tell, the same thing. It just depends on the state that you live in. I want to say LVNs are only in 2 or 3, and the rest of the country seems to use the term LPN, licensed practical nurse. So for the rest of this video, I'm going to say LPN, but know that those seem to be able to be used interchangeably. I have always worked with LPNs, so that's just what I naturally would go to say. So that's what we'll be using in this video, but just know that kind of as your baseline. Now let's talk really quick about what an LPN is, what they can do. So they are a nurse. They are trained typically through either an associate's program or a certificate program. And in order to gain your certification, you have to take a version of the NCLEX. So there is an NCLEX for a registered nurse and an NCLEX for an LPN or an LVN. So you have an examination at the end that then will give you this licensure. Now, in terms of what nursing roles and responsibilities you're able to do as an LPN, your state's Board of Nursing is going to determine that. So for an example, one state that I've lived in, our LPNs could, go in and they took care of the patient as a nurse would, except they couldn't do blood products. A registered nurse had to sign off on their assessments of the patient. So they would document it, and then whoever was in charge would go through and hit yes, I agree. And I think there was a few other just little restrictions like that. But that is going to vary based on the state that you live in. And a lot of this is going to depend on the state and the area that you live in. The programs to become an LPN are usually somewhere in the 1 to 2-ish year range, depending on how the program is structured. Obviously, prereqs will differ, and that's kind of the basis of an LPN and LVN role. If you guys have other things to add to that, I would love to hear it down below. Okay, so now that we kind of know what an LPN and LVN is, the second thing I want you to do is think, what is my long-term goal? Because that's gonna kind of inform how we get there, and what settings do you wanna work in? And then after you've decided what your long-term goal is and kind of where you might wanna end up, the next thing I want you to really look at is, where do you live and what do the jobs around you want in terms of licensure for the people that they're employing. So you're gonna go onto Indeed or whatever kind of job search site, and you're gonna look for jobs that you want, and then what do they want? Is it a posting for an LPN job? Perfect. Is your dream job something that does require an RN? And that's gonna kind of inform your choices from here on out. I think that third step there of really looking at the job boards and seeing the type of job that you want and what are they requiring is crucial in terms of deciding what is our long-term goal here. Because I'll be honest, the primary place that usually hires LPNs in many of the areas that I've lived is in long-term care facilities. And so when people ask me this, the thing I usually tell them is look at the jobs and where you can work. Personally, I know I would not want to necessarily work in long-term care. It's just not for me. And if you know that long-term care would not be for you, and if you go and look at jobs and really the only place that has postings for LPNs is long-term care, then maybe that's not the right step for you. But if you live typically in a little bit more of a rural area, they utilize LPNs on a much more to the maximum ability of their scope. When I lived in Michigan, we had LPNs that worked on the floors. However, they were phasing them out and giving them you have to get your RN in 5 years. So that's kind of all moving that way in terms of inpatient. I have seen LPNs that work in clinics. Again, this was in Michigan in a more rural area. So it totally depends on what your goal is and what what the area you live in, what they are hiring for. So I really don't think that there's a wrong answer here. It's going to be very different for every person. And I just want to really like totally squash out the I'm better than you hierarchy that there seems to be of like registered nurses versus LPNs. There's nothing wrong with having your goal be an LPN, especially if that gets you to the point where you're like, that's what I want to do. You know, like this, you find the job and you're like, oh, this is perfect. This is literally exactly what I want to do. Then perfect, full stop. All that being said, I think there is definitely a push for everyone to kind of get their RN. There's even like an even broader push to have everybody get your BSN on top of everything, which is a whole other thing. But if you were my friend and I was counseling you, and you weren't quite sure what you wanted to do, I would probably encourage you to get your RN just because it makes you so much more marketable in all over the country. There's just a lot more out there for registered nurses. So for that reason, I usually tell people like, if you're really not sure, I think being an RN is a good goal. And then within that, there's that whole like ADN versus BSN. And I have a whole video all about that and you know, which one might work for you. Again, it's just a time versus money and what's going to work for you better. And where do you live in the country vibe, but everything is kind of moving to BSN. So just keep that in kind of the back of your mind that your RN is going to be more versatile than your LPN, which can be kind of restrictive in terms of where you can get a job and what you can do within that job. Now, I get a lot of questions of people wondering, should I become an LPN on my way to becoming an RN? Like they already know, they're like, my goal is to become an RN. Should I get my LPN along the way? That again is going to largely go down to, do you want to do the job that an LPN might be able to get in your area? So for example, if the jobs in my area are mostly long-term care and I don't want to do that, then there's really no point for you to go and get your LPN and then have to do an LPN to RN. It's probably going to be around the same time frame anyway. And if you don't want to work in that role, then that doesn't make sense. If working in long-term care would certainly provide you with a lot of different skills. It's very challenging. You have so many patients and so much responsibility. That's why I would just like, it just stresses me out when people send me stories about it. So personally, that's why I wouldn't be able to do it. But if that is something that appeals to you and you would like to get in there and change the lives of so many people, that's a great stepping stone. It is usually much more affordable to go from getting your LPN and then going to your RN. And then if you want to eventually go to your BSN, like that is for sure the most affordable way is to kind of tack it along like that. Sometimes it can be easier, not that any of it is easy to get into, but sometimes it can be less competitive to get into an LPN program than to an RN program. So I've heard of some people kind of getting into the LPN program and then doing the bridge just to kind of get in the system. But again, just keep that in the back of your mind. What is your long-term goal? Where do you work? What kind of jobs are going to be there with this degree for you? There is no right or wrong decision here. Like I said, there is so much competitiveness in the healthcare field, especially in nursing, of like, well, I'm this and you're that. And that is not at all what I think this argument should be about. I think it should be, like I said, you looking and finding the job, like navigating it backwards, finding the job that you want, working backwards and saying, how do I want to get there? Do I want to spend the time? Do I want to spend a little bit more money and maybe get there quicker? And if your goal is to become an LPN, full stop, that's also okay. That is a perfectly fine goal, okay? What works for you and your family, it doesn't matter what everyone else is doing, guys. So that's my 2 cents on that. Hopefully that was a little bit helpful in trying to navigate that whole decision. I know it can be really overwhelming from someone who's not like within the nursing field. If you have any other questions for me, or more importantly for people who have probably walked this path, please go hang out in the comment section. You guys give each other such good insight. If you want to see more videos like this, talking about all kinds of life, nursing, parenting topics, make sure to subscribe, and I will see you next time. Bye, guys.